September. This month is a very special month because it is Blood Cancer Awareness Month. And if you didn't know, my name's Johanna. I'm 20 years old. On April 5th, 2019, I was diagnosed with acute lymphoblastic leukemia. I just really wanted to make a video kind of talking about different organizations that help people with blood cancers and different blood diseases, and also kind of talk about like what blood cancer is and a little bit about like what's going on in my life and how my treatment and everything is going. But I really wanted to make this like an informational video just because I feel like there's not that much information out there about blood cancer specific, and then also on top of that there's not a lot out there for like young adults and teenagers who have cancer. So I really want to touch on all of that, and I hope you enjoy this video. So a few days ago I asked on my Instagram for different questions about things that they would like to know about blood cancers or about my treatment and that sort of thing. And I got a lot of questions about people asking like, was it caused by anything or genetics? How did I find out? Did I feel like I was sick before I was diagnosed, and like what are some of the early warning signs? Someone asked like how it developed, because obviously like I didn't have this when I was growing up. So on that sort of subject, I thought I would talk a little bit about like what leukemia is and kind of like what the different treatments and symptoms are for it, and then go into kind of how I found out. So basically what leukemia is it is a cancer of the blood, and it specifically affects your white blood cells. And inside your bone marrow produces white blood cells, which help fight off infections. They produce red blood cells, which carry oxygen throughout your body, and they produce platelets, which help control like bleeding and clotting and that sort of stuff. And with leukemia, what happens is there's some sort of mutation in your DNA, so it is genetic, but it's not hereditary, meaning it's not like passed down through my family, and there's no like known causes for it. Basically, my DNA just mutated somehow and started rapidly producing immature white blood cells. And so since they're cancer cells, they don't die off, and they just continue like accumulating in your body and getting released into your bloodstream. And the immature white blood cells are called blasts, and the blasts aren't able to fight off infections like a normal white blood cell. So that's where you get symptoms such as like getting sick really easily. And the second thing that it causes is because it's rapidly producing all of these cells, it kind of crowds out the bloodstream for your red blood cells and your platelets. And so some other common symptoms are like being really fatigued and having anemia, like bleeding, like getting bloody noses all the time, or bruising really easily. There's different types of leukemia. So there's acute leukemias and there's chronic leukemias. And basically the difference between the two is acute leukemias spread really quickly, whereas chronic leukemias are kind of like slower growing. Basically that's what leukemia is. In my particular case, I have acute B-cell lymphoblastic leukemia. So basically what that means is it is a rapidly growing leukemia. It affects like my B cells or something like that, and it affects the white blood cells called lymphoblasts. Treatment for leukemia basically varies on the type of leukemia you have and what your body can handle. So in my case, I was healthy enough to be on a pediatric regimen, which is the most effective. It's the longest. It's 3 years of chemo, 3.5 years, give or take. But it has like the highest cure rate. So I consider myself pretty lucky with that. So treatment options are chemotherapy, which is what I'm getting. Some people I think may need radiation, but another big treatment that people do is a bone marrow transplant, which I'll talk about that a little bit later. And I'll talk about Be the Match, which is a great organization to volunteer for or sign up for. Like I said, I didn't have any symptoms. So how I found out is I went into urgent care having some chest pain, and they did some tests and they sent me to the emergency room because they came back abnormal. And in the emergency room they did a CT scan and found that I had blood clots in my lungs. So they admitted me at the hospital, hooked me up to some blood thinners, and the doctor came and talked to me the next morning and basically told me that I would be put on some blood thinners for the next couple of months, and just to be extra careful about getting any cuts or anything like that. But I would be able to go home and get on with my life, basically. He came back about an hour later and said that my tests had been sent to pathology and came back abnormal, and I was going to be sent to a specialty hospital up outside of Portland. So I asked him, like, what does this mean? And he was like, well, like, I don't want to say anything for sure, but we suspect that you have leukemia, which is a blood cancer. And that was a pretty big shock, and I didn't tell anyone because, like I said, like, I didn't have any symptoms. I didn't feel sick. I went to school the day before and was completely fine. So I kind of didn't think that it was really true. But then I was transported by an ambulance up outside Portland, and I was admitted onto the oncology floor. They redid my blood work, and they confirmed that I did have leukemia. And from there, they needed to figure out the specific type of leukemia, which, to figure that out, they need to do a bone marrow biopsy, since that's where the cells are produced in your body. They took out some bone marrow and determined that I had acute B-cell lymphoblastic leukemia. From there, they did some tests on my heart and just figured out how healthy I was, and we determined that the best treatment plan for me was to be put on that pediatric regimen. I got a question about how long I will be doing chemo for, and my treatment plan is broken up into 5 different courses. So course 1 is called induction, and that was 29 days, and that is when I was in the hospital. So I did that inpatient for 29 days. Well, I was in the hospital for 37 days, receiving chemotherapy. At the time, I had a PICC line put in my arm. So basically what it is it's a tube put through your arm that goes up, over, and then down into like right next to your heart, so like your main blood flow. And I got the chemo put through there. And then I was also receiving intrathecal chemo, which is basically they do a spinal tap. So they take out some of your spinal fluid and then they put chemo into your spine so that it can get in your cerebral spinal fluid, because that's a place that the cancer likes to spread to. So I did that for 29 days, and at the end of my stay, they repeated the bone marrow biopsy, and they confirmed that the chemotherapy had been working, and I was technically in remission, and they couldn't find any more cancer cells. But, with leukemias, and with acute leukemia especially, they know that it regenerates super quickly. When I had my blood drawn at the hospital in Salem, my blood was at 60% cancerous or whatever, and by the next day it was up to 80% cancerous. I'll try to insert pictures of what my blood smears looked like, and you can see.
This is an example of what a normal blood smear looks like, and this was my blood smear, so the purple represents all the leukemia cells.
So from there I started course 2, which is called consolidation. Course 2 sucked for me. It was really hard. It was all outpatient, so I had to drive into Portland and getting chemo 4 days a week. The hospital I was going to is about an hour away from my house, and so that was exhausting on its own. I also had a lot of complications during course 2, so I was still receiving the spinal chemo. That caused me to get a spinal fluid leak, and then I got a spinal bleed, and I found out I was allergic to one of the antibiotics I was on and got aseptic meningitis. So for all of these different things, I was back admitted into the hospital, and then I was taken off of blood thinners because of the bleed in my back, and because of that, I ended up with more blood clots in my lungs, and so I got put back on those. It was a rough 8 weeks. Yeah, it was 8 weeks. But then I started course 3, and course 3 was a lot easier. It's called interim maintenance. During course 3, which I'm on right now, I'm receiving chemo about once every 10 or 11 days. But yeah, so far I haven't had any complications with course 3. I actually have my last dose of chemo this week for course 3. And then I'll start course 4, which is called intensification. So that's freaking scary. And it looks like it's going to be really hard, but it's basically, that's another 8 weeks. And it's basically another big final whack before I start course 5, which course 5 is called maintenance, and maintenance lasts for 2.5 years. So it's the longest part, but it's mostly just taking an oral chemotherapy drug, and then going in for infusions like once a month. So it's a lot more manageable, and that's what I'm hoping to be going back to my university. Some other questions that I got from people is, this is a good question. How have you dealt with anxiousness and depression? I feel like it's very overlooked in cancer patients about how prone they are to having like issues with mental health. I did experience a lot of anxiety in the hospital, and with that like comes depression as well, just because it can be very isolating, especially being a student and like having all of my friends be back at school and like, I don't know, continuing on with their life. It was kind of hard for me. Going along with another question that I got, someone asked me, what is the best thing a friend can do to support their friend going through treatment? And I think that this is something that has helped me deal with depression and anxiety a lot, is that I've had an amazing support system. I've had really great friends throughout all of this. I've had my sorority, which has been super amazing. I've had my family, which like thankfully my mom works from home, so she's been able to drive me to all of my appointments. Makes things a lot easier for me because that's one less thing that I have to worry about and one less thing to like get anxious over. Some things that like I would say that friends can do to help another friend going through treatment, just checking in on them. I've had a lot of great friends that like have Snapchatted me every day and just been like continuously like asking how I am, and so a lot of my friends have been really great about like still treating me the same, not like treating me like I'm sick, which helps me to feel more normal. It's honestly just the little things. We have phones, we have social media and Snapchat and texting and all of that. And so it's really easy like, to stay connected with friends and family and all of that. And so that's been something that's really helped me not get depressed. Anxiety's been another thing, since I've always been kind of like an anxious person and I always like overthink everything. And especially going through treatment, everything's kind of like up in the air and you have to take things day by day. So that's been something that's been kind of difficult for me, but I did recently start going to a cancer counselor. I've only been once, but I'm planning on going more just because I feel like it can help to talk to someone. Another question that I got is, how did you find the perfect wig? And I actually have a bunch of different wigs. This one is my like most expensive wig that looks like my hair from before. There's different things that you can look for with the wig. The main one is like a lace front wig, which I can show what that means. This is a wig that I just got from Amazon, but in the front there's this lace right here, and so that lays on your skin and it makes it look more natural. There's also like synthetic wigs and real hair wigs, and so this one's made out of real hair, and so I can like curl it and straighten it and wash it and everything, whereas this one is a synthetic wig, and so it's just like made from plastic. I got this wig from a wig shop in Portland that specializes in like hair loss and that sort of things. Another question I got about wigs is if they're itchy or not, and I personally don't find them itchy. I kind of like having something on my head just because otherwise it gets cold. But they are like a little bit uncomfortable, but you can wear wig caps, which most people, like if you have hair, you'd wear a wig cap to keep it from coming out. Take my wig off. I don't have any hair, so I don't have to wear that. But this is like, so that's like a more expensive wig. This is a wig that I just got for like 30 bucks off of Amazon. And you can kind of see just how the other one looks a lot more realistic. The hairline on this one doesn't look as natural. I think Amazon's like a fun place to find fun wigs. So like I also have this extra long pink one, which is fun to mess around with. And this one is also a lace front. Most of the wigs that I have are the lace front just because they look a lot more natural and you can like cut it to match your hairline. Another question that I got asked was, what is your favorite thing to do to pass time while you're getting treated? A lot of the times my chemo treatments aren't that long. The longest one I think that I've had can be like 4 or 5 hours. But for that one I get pre-meds for it, and it basically just makes me really sleepy, so I sleep the whole time. The other times when I get chemo, just a few hours. Most of the time I honestly just talk to my nurses just because they're all super sweet and super fun to talk to. Watch a lot of Netflix or like YouTube videos on my phone. When I was inpatient in the hospital, one thing that I did all the time, which was like kind of weird, but I thought it was really fun, is I painted a lot of birdhouses. You can buy like 99-cent wood burn houses from Michael's, and I just got a bunch of paints and painted those in my room. And then coloring books, watched a lot of movies, and mostly just like FaceTimed with friends and that sort of stuff to pass time, just so I didn't feel like as lonely. Another question that I got was about like blood transfusions and getting chemo. They basically asked, when I have a blood transfusion, since it's thicker than other meds, does it feel different? And then going off of that, like, what does getting chemo feel like? For me personally, some people can get the chemo through their veins, like in their hand or in their arm, if they're not getting as many treatments. Like I mentioned before, I also got chemo through the PICC line in my arm. But now I have a chest port that was put in, and basically it's just a little circle underneath my skin, and they put a needle into that, and it's the same thing, like the same idea as a PICC line, except it's under your skin, and the tube goes up and over down into the main artery as well. So I get chemo through that, and I get my blood drawn through that. Honestly, getting chemo doesn't feel like anything. It just feels like getting like an IV put in. Like, getting a blood transfusion pretty much feels the same. I don't know if it's like normal or if it's just me, but sometimes getting a blood transfusion can kind of like make my joints feel warm. And I don't know if that's because it's like thicker or because I was low on blood and really cold. That's the only difference that I've noticed, but honestly, getting like a blood transfusion or getting chemo doesn't feel like anything. So a lot of people asked about my therapy dog. This is Moose. He's still a puppy, so he's still going through training and is obviously a little bit wild. But my goal is to get him trained to be a therapy dog, so he can be able to go into the hospital and just like kind of cheer up the patients that are inpatient going through chemotherapy. Just because it can be kind of like lonely in the hospital, and I don't know, dogs always cheer people up. But I got Moose actually through an organization that I'll talk about towards the end of this. Oh my god. Stop! Too many kisses. Oh my gosh! He's actually a really big pain in my butt. But we're working on that, right, Moose? Can't you picture him in an oncology ward? So I wanted to end this video kind of talking about different organizations that support people with blood cancers, or also like provide awareness and different opportunities for people with blood cancer. The first organization that I wanted to touch on is the Leukemia and Lymphoma Society, which this is probably like one of the biggest research and awareness organizations that specifically targets different blood cancers, provide research and funding and awareness for blood cancers, as well as they help assist like families and patients going through treatment with whatever they can do. And they put out just a lot of awareness for different blood cancers and different statistics. So I know especially for this month, they've been posting a bunch of different statistics and facts about blood cancers, which I've been following and I thought was really interesting. So check that out, make a donation, research it, do what you want. Another good organization that specifically helps with young adults is the Dear Jack Foundation. The Dear Jack Foundation is an organization that I found out about while I was actually in the hospital. They specifically help young adults and adolescents with cancers or like lifelong illnesses. And they have some different options with like different programs that they provide. So one program that I'm a part of is their Lifeless program, and it's basically kind of like Make-A-Wish but for young adults. And so that's actually how I got Moose, my therapy dog. And I named him Moose because my favorite animal is a moose. And for my life list trip, they're actually sending me to Alaska in a few days. My boyfriend and I are going, and our goal is to see a moose. And so they've been really great. They've also been really great at connecting me with other young adults who have cancer and like similar diagnoses as me. So that's been really great. And they also just have different retreats for people and their families or like spouses going through different cancers. And what I found interesting is the Dear Jack Foundation was actually started by a singer-songwriter named Andrew McMahon. You might have heard of him. But he was actually diagnosed with the same type of leukemia that I have back in 2005. And he got a bone marrow transplant. And he was diagnosed when he was about like 21, I believe. And he found that there wasn't that much support for young adults with cancer. So he started the Dear Jack Foundation. And it's really taken off since then, so I would highly suggest checking them out because they've been really supportive for me. The last organization that I want to talk about is Be the Match. Be the Match is another bone marrow registry organization, and they also provide a lot of awareness for different blood cancers. And what's great about Be the Match is it's super easy to like donate your time or like participate in it. All you need to do is go to like a Be the Match booth, or you can do it online even. Fill out some information about yourself, and if you're at the booth, you can do it right there, or if you do it online, they'll mail you a little swab, and you swab your cheek, and then they send it in, and that basically puts you in the bone marrow registry. For a lot of people who have like a blood cancer or different like blood disease, such as like aplastic anemia, things like that, they're very easily cured with a bone marrow transplant or a stem cell transplant. However, you have to have a match. That's like a big goal of Be the Match, to expand the registry as much as you can so that people in need of a transplant are able to get one. And it's super easy. A lot of the times it's basically just like giving blood, but it is one of the only like cures to cancer. And it's just something that's really important and something that's super easy to do. I know specifically that they need a lot more people who have different ethnically diverse backgrounds, just because it's harder to find a match within the system. So I highly suggest checking out Be the Match and trying to join the registry. But thanks for listening. I'm happy to answer any more questions in a future video, or if you just want to comment down below if there's anything else I should touch on. But happy Blood Cancer Awareness Month, and I hope you enjoyed this video.